serious issues, particularly the very painful early years of HIV, AIDS, when people talk about conspiracy theories. You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. You know, I can assure you, we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.
Dr. Birx, you said something about not enough tests being performed because some of the labs, the machines aren't running. Did you want to clarify that? What did you mean by 80% weren't running?
So I have a call with them at 8 p.m. tonight. Every single one of those 120 laboratories, I think 87 of the laboratory directors have confirmed that call. It has to do with a machine called an Abbott M2000. It's a very high throughput machine. We have 1 million tests out there. I made a big push, and Abbott was extraordinary about getting those out to the labs. I mean, this is not sitting in a warehouse. These are physically in these laboratories, sitting there right now.
The machines aren't running.
They're not running. So we've only run 88,000 tests in 3 weeks off of those machines with 1 million test kits. So as someone who has worked in a lot of laboratories, to have a machine that is needed, because we could have screened every healthcare worker. These machines are every place in the country. So they could have screened in these last 3 weeks 100% of the healthcare workers across the country that needed these tests to be done, and they're high throughput. So I have a call with them at 8 o'clock to really talk about.
Can that to happen? Can an order be given?
Well, I asked the vice president to give me a chance to talk to my colleagues first, but we have a call with the CEOs of those hospitals tomorrow.
Great. Thank you. That's a really important question, and it underscores the fact that Dr. Birx pointed out that with this new test, Abbott Laboratories, FEMA's been busy distributing to states around the country. We purchased 1,200 of these machines to be able to do these tests, but there's 18,000 all across America. And so let me just renew our call to all the hospital administrators and lab operators around America to go and identify those Abbott Laboratories machines and know that while we've already tested more than 1.9 million Americans, our short-term objective is to test as many Americans as possible as we see the coronavirus epidemic emerge in areas around the country. We want to surge those resources. We want states that haven't seen a significant outbreak to have access to that 15-minute test. And ultimately, as we go forward, I think President Trump said today, nobody wants to open the country up more than him. And I can attest to that. But we're going to open it up when we can do so responsibly, putting the health of America first, and to reopen America and to stay open America. We're working around the clock to continually expand the kind of testing that will allow us to do what these experts call surveillance, so that in every state in the country, once we put this chapter of coronavirus behind us, we hope and trust sooner rather than later that when next fall comes, that we will have a vast array so that CDC can do what it does so well. And that is when a particular disease emerges, CDC surges personnel, does contact tracing, isolates that individual. So we're just really calling on calling on all of our partners in the laboratories and in hospitals around the country to identify those Abbott laboratory machines.